Welcome everyone. So I'm going to start today's virtual learning cafe, and this is part of a series of virtual learning cafes we host here at the Youth Endowment Fund. And this focus is predominantly in respect of health. My name's Nicki Bramford and I'm Head of Change for the health sector. So just a bit of housekeeping before we start. The session today will be recorded and it will go on to our Youth Endowment Fund website. So if you have colleagues or people in your network who haven't been able to join today, then please do point them towards our website anyway to sign up, but also that they can have an opportunity to watch today's virtual learning cafe that's been recorded. So for those attending the delegates, just to advise, you've probably noticed that your cameras will be off during the session. We're going to keep questions to the end, so we'll allow about 10 to 15 minutes dependent on time, and that will be an opportunity for any reflections, any questions, any discussions you'd like to have in this space, because this is really very much a learning opportunity. If you do have any questions, then please do pop them in the chat, and you can do that during the duration of today's session. And if you'd like to raise a question at the end, then please, if you can just use the raise your hand, and my colleagues will turn your camera on and will invite you to ask the question. So we have two really brilliant speakers and areas that we're focusing on today. So firstly, we're going to have Andrew from NHS England, Health and Justice, and he's going to begin with about a 15 to 20 minute overview of the framework for integrated care and really thinking about the focus on shared understanding, relationships, which is at the core of everything we do, and system change. And then I'm also really delighted to say that we've got colleagues from Positive Directions, and we're going to hear about their journey, their model, and the learning and impact in practice. So the theme running through today is in respect of young people, this collaborative and partnership working, and also in respect of the space of children with complex needs and taking a very child-focused approach. And as I said, the kind of thinking is really going to be framed around relationships, communities, and systems around them. So I'm more than delighted to say that I'm going to hand over to Andrew, and thank you all for joining us today.
Thanks, Nicki. Hi, everyone. My name is Andrew Nichols Clarke. I'm the Head of Health and Justice Children Programme for NHS England, as Nick has just said. And I'm going to present very briefly an overview of the framework for integrated care, but then I'm going to allow the Positive Directions team to really give you an in-depth insight of what that looks like, actually means on the ground and what it looks like and how it works for the young people. So if we can just go to the next slide, please. So I think it's important to say that our statutory responsibility in NHS England is to deliver healthcare into the children and young people's secure estate. So that's our young offender institutions, our secure children's homes, secure training centre and secure school. We've been delivering care directly into those ever since the inception of NHS England. And over the last 7 years, we've been delivering a programme of integrated care with the operational and residential staff for those young people. But we've really got the opportunity to understand these young people, and we've seen where they've come from, their backgrounds, and understanding a little bit more about why they've ended up where they are. And all of these young people have multiple complex needs. As you'll see on the slide here, they have mental health needs, but multiple, perhaps more than one, diagnosed or undiagnosed. They have physical health presentations, but they've seen adversity and traumatic experiences. That often plays out as offending behaviours. We see high rates of family difficulties, and some of the statistics we've got on that now from the work that we've done, you'll see as well. We see education disruption. In fact, 90% of the young people in the secure estate have had disruptions in their education. And there's also a lack of trust for both the children and young people and the families and carers as well. So we we've been very good at developing very complex systems for these young people. And actually they bounce around those systems, never being supported really where they need to be in the best manner. And so often end up in the settings that we have, or also our secure mental health settings as well. So we started to look at this and wanted to deliver something more at a preventative end to stop the escalation of those needs for those young people. And as I said before, we'd seen them bounce around those systems, and sometimes we didn't actually see them until they came into the secure state, and it was the first time we'd seen them in a health setting or anything like that, but their needs had never been met. If we can go to the next slide, please. Because of their complex morbidity as well and their needs, our services right now are set up to deliver needs according to a diagnosis or a specialist intervention. And actually, these young people have multiple needs in multiple domains, and our services are only seeing them in the way that they want to see them, in the way that they need to see them, rather than as a whole in a holistic manner. So the framework for integrated care was developed to develop this shared understanding. If we go to the next slide, please. You will get the slides for these, but the framework for integrated care has been developed and published by the Anna Freud Centre. It's been developed through the NHS England, and it also contains some of the evidence and understanding that we know from our 11 areas that are delivering this, of which positive directions is one of them. If we go to the next slide, please. And the framework gives us essentially 6 principles, and we ask our 11 areas to work through those principles and deliver those principles, but how they're delivered is different in every area. And that's the real crux of this. Our young people are quite flexible and dynamic, and therefore our services need to be. And quite often our statutory services aren't able to flex with the needs of the young people. So it's really important that we have a system that allows us to do that. And this is actually this is for the system. This isn't just a health intervention. This is health funding, but it's actually for a whole system in the community, right around these young people where that need is needed most. If we go to the next slide, please. What the framework isn't, is it isn't a thing or a set of principles to tick off. We have got a set of principles, but they're not just to tick off. They're actually, it's actually there to use and really thoroughly deliver. It's not reinventing the wheel. Trauma-informed care and formulation-led care isn't new, but as a system level and delivering it across a whole system and supporting the system to understand that is quite new, and it's evolving what we already know. It's not a model, as I said before, that's aligned to a single treatment. So again, it's really easy to do a diagnosis and a treatment in a clinical setting. But actually these young people don't respond to that straight away. So it's about meeting the young people where they are. And it's not owned by a single individual organisation or profession. This is truly a whole system response for these young people. It can often be seen as a soft option, but it's absolutely not. Building a relationship with a young person is an intervention in itself. A formulation for a young person is an intervention in itself. And that's what we're talking about there. It's not just the intervention isn't solely based on the young person, it's on the context of what's happening for them and their families and their carers. And it's not just about one-to-one therapy or a program of work. So, you know, we're not saying that these young people don't need those sessions of CBT, but actually if they don't feel safe and secure and stable in the environment that they're in at the moment, then that 10 sessions of CBT isn't going to be worth anything for those young people. So it's about delivering things in the right context and giving them access to the support that they need and their families need. If we go to the next slide, please. So it is about a framework and a language that can guide a whole system change. It's about a way of being and how we turn up to work as well, because these young people do cause anxiety in our systems and our services. And as I said before, they have been through the processes of expulsion from school, referral to CAMS, CAMS say it's not CAMS, education can't keep them any longer. They're not being seen by this service, they're not being seen that, and that anxiety can cause anxiety to the whole system. And then how we play out to our colleagues across that system then plays out in the same way that the young people have played out, and they will catch on to that. So if we are really truly clued up as a system to work around the formulation for these young people, it's better, and it's how we turn up to work as well. It is a scaffold for our day-to-day practice. And it draws on evidence and understanding, especially around that we've learned from the secure estate and the young people there. The really important thing as well is it's a permission to do things differently where required. So you will hear from Positive Directions about some of the amazing work that they do. And it's about delivering things differently. What does the family need? What does the child need? We have got examples where a young person's been referred into one of our 11 sites, and the services have ended up working with the family because that's what was needed. It wasn't an intervention in the young person. It was an intervention in the young person's family and circles. And so that's why it's really important to do that. So what does it actually look like? If we go to the next slide, please. So it's brave, aligned leadership and commissioning. So allowing people to do things differently. It's that shared language across our organisations and our systems. It's about cross-organisational change as well. And that takes time and culture change, and we know that. So there needs to be that commitment to do it, and the commitment and funding to do it long term. And it's understanding the holistic impact as well. And how do we measure that? How do we know we have made a change when it's not necessarily based on a key performance indicator for an intervention or a single service? How do we measure that change? And that's some of the stuff that we're starting to think about. We go to the next slide, please. Thank you. So on the ground, what does it look like? So there's an integrated team, and you will see this through Positive Directions as well. In cross-agency universal training, so across our 11 sites, which we call Vanguards, there has been a whole host of training happened across various different services, including police, schools, social care. We've even got a Vanguard site that have done it to fire services as well, and it's actually become a mandatory training for fire services as trauma-informed care and knowledge of trauma-informed understanding. So that's really, really important. The element of reflective practice and clinical supervision for all staff is really important as well, because as you will see and start to understand, this is about supporting the system to support the young person. So it's not actually necessarily dropping in a specialist clinician to support the young person. It might be dropping in a specialist clinician to support the people already supporting that young person, because the last thing we want to do is make that young person retell their story time and time again to all the professionals that come into their lives and back out of their lives. So long as we're there to provide that clinical supervision, because as I said before, this is a difficult area to work in and they cause anxiety to the system. If we provide that supervision, reflective practice, chance to talk through the case, then we can support the adult supporting the young person. And it's that shared formulation, one plan across all agencies for those young people, so as they're not having to repeat everything, and every service understands them in the context that they're in as well. The interventions that are delivered are paced by that formulation and delivered through that formulation as well. And it's a lot of it is around relational skills and trusting relationships. And we see that time and time again, and you'll see some results in a moment. And there is specialist one-to-one assessments and interventions alongside that, but they're not standalone. They are part of that formulation. It's not just a simple referral, oh, that's your intervention now, and that's your next intervention. It's actually going on a journey with these young people. If we go to the next slide, please. So we've started changing the language as well, so it doesn't feel like it's a one agency program or health. We are using things like framework, we're using things like referral guidelines rather than referral criteria and thresholds. We're understanding the context of the individual cases, and therefore those rigid thresholds that we see and cause anxiety into the systems are slowly being removed as well. We're looking at level of concern rather than diagnosis, and a level of distress rather than mental illness. And we're using evidence to inform everything that we're doing as well. And we've stopped using the term complex needs for young people, because actually it's the systems and the situations that they're in that are complex and have made that. So we've started to really change that language. Changing the language across the system builds that integrated way of working together as well, and that better partnership working for those young people. And we've started using therapeutic rather than therapy as well, because everybody can start getting their heads around that. We're not asking or turning our staff, education staff, social workers into therapists, but we are starting to think about how they can therapeutically work with a young person that requires that support, or a family. If we go to the next slide, please. And thinking about that intervention as well has many definitions. We can have traditional CAMs, we can have medication, but also formulation. Just doing a joint plan across systems is an intervention. Assessment, just a consultation or a phone call with a specialist member of staff. Can we just have a conversation about this young person that we know? They're all interventions, and they're all supporting the system. And again, we need to think about how do we make sure that that works, and how we're recording that work. We go to the next slide, please. So as I say, we developed the framework for integrated care and everything you've seen, and we now have what we call 11 Vanguards delivering this across the country. This was done through expression of interest about 3 years ago, and the Vanguards have been working for through this. And as I said before, all doing completely different things, set up in completely different ways, because it was really important that it was delivered in the context of the community and the local system that they're working in, rather than us standing there and going, this is a national service specification, this is a highly specialist service, we're going to drop it already into this complex system that you've already got, and we're going to make sure these complex young people navigate it. And it wouldn't work that way. So this way, each area has delivered it and integrated it in their own way. If we go to the next slide, please. So within that, we've got over 40 voluntary sector organisations. That was one of the mandated things for the Framework for Integrated Care Delivery, because those organisations are already working with these young people, doing brilliant things. So how do we bring them in, create them as part of that system change? We've seen over 14,000 referrals now, which has been massive. And as I said before, we've seen training across multi-agencies as well. If we go to the next slide, please. We do collect data from all our Vanguards, and one of the data that we do collect is about trauma and known trauma and understanding. So the highest trauma that we do see is parent or family separation, and household domestic violence, and then emotional neglect, and it goes down there. But you'll see the list of traumas. Any one of those, any young person can have multiple of those traumas as well. And we see that increasingly, the more and more traumas that we're seeing. What we have started mapping against, though, is those traumas and what the primary needs are that the young people have been presenting with, so as we can start understanding what that trauma is doing on those young person and the needs, and therefore their behaviours, and understanding that a little bit more. And then we also collect diagnosed conditions as well. But as you can imagine, a lot of the young people come to us without an official diagnosis, and it's working through that as well to support those young people. If we go to the next slide, please. You'll see here the percentage of young people that we actually see with multiple traumas across the system as well. So a lot have, when we see them have one trauma, but then We understand later on down the line as we're working with them and as teams are working with those young people that there's multiple traumas appearing for those young people. If we go to the next slide, please. So this just summarises what we already know about those young people and their families, the presentations, what's happening around them, and then what diagnosis is going on. And if you look at all of that, not one service is set up to do that, and neither should they be. This is a system response that we need to do for these young people. It's not a single issue pathway, and it's fragmented care. It's not about that. And also the thresholds, putting thresholds in can obscure the lived experience that other young people have got as well. So it's about removing those thresholds, and they don't present neatly with those in those boxes that we often diagnose them with. So it's about removing that and taking that away and working as a whole with those young people. If we go to the next slide, please. Of those 14,000 referrals that we've got, 98% of them have all had a formulation as an intervention. And this is an intervention for the system and for the young person as well. And 96% of them have received relationship building support for both children, families and carers. And that's what we were talking about before. This is a lot about building relationships, building up the trust back up with these services that are, and those individuals that are there to support those young people. If we go to the next slide, please. And then just quickly on to the next one as well. So it started as making us think about what therapy it actually looks like, that therapeutic support. What does it look like? Taking it away from that clinic setting and the hospital setting. What is different for these young people? And you'll hear some amazing examples in the next presentation, so I won't go into detail. If we go to the next slide, please. What we have seen, though, and started recording is the impact of the framework for integrated care. Young people have started displaying with improved mental health and well-being, better social relationships. There's an increased stability of home. We've seen placement breakdown reduce. We've seen the reduction in use of deprivation of liberty orders as well. We've seen young people staying in school or returning back to school where they wouldn't. There's reduced anxiety for the child and the family, a reduction in highest risk behaviours, and there's more effective integrated care happening. And for the staff and the system, because this is just as much about the staff as it is about the young people in the system, we've seen improved working relationships, enhanced collaboration, and reduced system stress. So that anxiety that these young people can often cause has been reduced across those systems. If we just go to the last slide, please. So what we are starting to do is understand a little bit more about how this culture change is working. What we now have to do is think about how we measure that. Has the narrative changed? Are we seeing policies change? Are people talking in a different way? Is the system working together and talking in a different way? Have we seen a change in relationship and connections between colleagues, young people and families, agencies? Again, we want to see those policy changes, but the really big one is there a shift in resourcing? Because we've made a difference at a preventative end, are we seeing cost benefits in those high-end services that we're trying to stop those young people coming in? And will there be a shift in resources? Now, that's going to happen in time, in a long way off, but that's what we're starting to look at, and we're starting to look at cost benefits. What's the cost of our interventions through the Vanguards compared to putting a young person on a deprivation of liberty order, putting a young person in a secure placement and things like that? So that's where we're starting to try and understand a little bit more with that. That's given you a national context of where we are and what we're working towards. I'm now going to hand over, thankfully, to my colleagues from Coventry and Warwickshire, who's going to really just give you an in-depth look at what it looks like on the ground and feels like for them. Lynn, Becky and Emma.
Oh, thanks, Andrew. Fantastic introduction. Hello, everybody. Bear with us whilst we just get the slide deck up. Can you see that okay? Yeah,
we can see that's great.
Thanks. So Good afternoon. So I'm Lynn Ranson. I'm the clinical consultant lead for the Trauma Vanguard. I'm joined today by Becky Richards. She's the deputy lead for the Vanguard, and Emma Hallovo, who's our lead trauma-informed practice educator. Thank you so much to the Youth Endowment Fund for inviting us to speak with you today, and to share the impact of the Positive Directions framework, a framework designed by our children for our young people. Since launching in 2023, it's supported over 400 young people at risk of presenting a mental health crisis. It's prevented children coming into care, as well as strengthening home and care placements to prevent breakdown. And it's also protected specialist services and reduced CAMS and neurodevelopmental waiting lists. In addition, it's supported young people at risk of or being criminally exploited, as well as focusing on community engagement to strengthen our system's serious youth violence duties. Next slide, please. So as Andrew has already introduced, we're the West Midlands Trauma Vanguard. We're hosted by Coventry and Warwickshire Partnership NHS Trust, which is a community mental health trust, and we're one of 11 recognised test and learn sites supporting the framework for integrated care in the community. Being selected for dedicated NHS England investment has been a unique opportunity for us to innovate locally at scale, embed trauma-informed practice, test creative approaches, and build an integrated system of support for our young people in the most complex situations. The evidence from our test and learn site is so compelling that the learning from our Vanguard is shaping national practice and policy, particularly improving coordinated integrated support for children in, as I say, these complex situations. Next slide, please. The young people we support have experienced a range of traumas, adversities, and some have emerging mental health needs. Without timely relational support, distress escalates, impacting on the child and family, as well as the services and practitioners that seek to support them. Behaviour is often medicalised or criminalised rather than understood as a trauma response. Early intervention from positive directions approaches reduces escalation, improves outcomes, and is both clinically and financially effective. Next slide, please. So our work is rooted in what children tell us. We did a needs analysis right at the outset, and our children told us, don't label us mad or bad, connect us to our communities, and ensure staff understand our story, asking what's happened, not just what's wrong. By co-designing services around these principles, we have evidence that engagement improves and positive outcomes follow. Next slide, please. So Positive Directions is a whole system, trauma-informed framework integrating 3 elements. Trauma-informed foundations, with our practice educators coordinating training and upskilling, supporting multi-agency communities of practice, working directly with teams, building capability across statutory and our voluntary sectors. We adopt a social prescribing approach. We connect children to meaningful non-medical support to build friendship, identity, purpose, and belonging. And then we've got embedded practice test sites. These have what we call positive directions practitioners, occupational therapy, support, and speech and language therapists, all co-located into a local authority team, shaping day-to-day decision-making. We support children aged 8 to 18 who have experienced trauma, many awaiting CAMS or neurodevelopmental assessments. Our engagement typically lasts up to 6 months, allowing, as Andrew said earlier, trust and those behavioural trajectories to shift. Our framework is scaffolded by case formulation, trauma-informed supervision, and reflective spaces. But the impact comes from how these work together. Training changes thinking, social prescribing changes options, and embedded practices change behaviours. Together, they reduce escalation and protect specialist services. Next slide, please. So now some outcomes. So since January 2023, 400 young people have engaged with our support offer. Our suite of qualitative and quantitative data shows an 80% improvement in well-being, mental health and education engagement. We've seen a reduction of 90% in risk-taking behaviours. This includes self-harm, suicidal ideation and exploitation. We've seen, again, over 80% of children continue to engage in community activities after the programme. And we've seen 57% of young people either removed from CAMS or neurodevelopmental waiting lists or referrals that weren't required. We've also seen 100% compliance improvement for court orders. We have a speech and language therapist co-located into the youth justice team, and through her support and suggested reasonable adjustments, that impact is incredible. As I say, following the supported interventions, 57% of our children no longer require those specialist mental health or neurodevelopmental referrals, creating £1 million saving for our mental health trust. But beyond financial savings, this means shorter waiting lists for those who truly need specialist intervention, early help in the community, reduced system pressure, and better outcomes without escalation. This is prevention in practice. I'll now pass you to Becky to share about the trauma-informed practice approach of our project. Thank you.
Lovely, thank you, Lynn. So yeah, just to talk a little bit about our training offer. And as we explore the trauma-informed foundations of our framework that we've been talking about today, our goal is to build a real, truly predictable and supportive network around the young people that we are supporting across Coventry and Warwickshire. Currently, because different organisations naturally have their own internal cultures, as we do see, a child can sometimes experience real contrasting responses depending on which service it is that they actually interact with. And when a system feels inconsistent, it can inadvertently reduce the feeling of safety for all of us. So for a young person specifically who has already really experienced that instability. So to bridge these gaps, we've developed a comprehensive system-wide training offer. As Andrew was talking about earlier, it is about the whole system. And as part of our project's core response to supporting the supporters, and that really does really kind of build the foundations as well for a few of our training modules. So by equipping our entire workforce with a unified language, shared tools and continuous supervision, we are moving away from disconnected approaches, moving towards a more reliable joint infrastructure. So this really does ensure that no matter which door a child walks through, that they meet a workforce that provides absolute safety, predictability and trauma responsiveness. So here you'll see our training development roadmap, and this slide really does reflect our journey, and it reflects what we deliver, and it gives you a bit of a rough overview really of the timeline of our development. So moving from the development of our trauma-informed training modules, as you'll see right at the beginning there back in July 2022, this then really elevating our work to become a self-sufficient, for example, we moved into developing a train-the-trainer programme as well. So we always seek to encourage trauma-informed shared language and approaches right across the system, whatever system it is that's supporting our children and our families. So supporting a more integrated approach, encouraging more relational responses with children's needs being met where they are rather than relying on unnecessary referrals across the system. And so we hopefully will then see a less clogged system, meaning that the referrals and the requests for support and for specialist support too get there quicker with less waiting lists. And there's also more potential then, we hope, for that earlier intervention, you know, with needs being recognised earlier, supported earlier, reducing escalation, requiring further interventions. So our learning pathway, as we share the learning from our pilot project, this single diagram tries to hopefully captures our most significant realisation. And what started as a project simply to deliver trauma-informed training quickly evolved into something much more profound And what I've tried to reflect here on this diagram with you is a sustainable learning ecosystem. So we started, like many projects, with traditional training, and this is vital for giving staff the foundational what, the knowledge, the theory, and the principles of trauma-informed practice. But we quickly realised that this is a sensitive field. Trauma transfer of information alone isn't enough to change behaviour or manage the emotional load of the work as well, and recognising that. So this led to our key learning point, the heart of our model, the reflective learning space. This is where we truly believe that the magic really does happen here. So we deliberately built in time and psychological safety for practitioners to move from simply knowing about trauma-informed practice to really having the space to explore how it feels, what it means for their day-to-day practice and interactions. And it shifts the focus from doing the training to being reflective in their own work. And it literally is, as we say, it's always a great space for growth and professional development as well. So, and it's this central reflective space that feeds all of our high impact interventions. So we continue to deliver this training, targeted training, and we use the insights from the reflection to focus on specific skill gaps. We're always in a space of learning what those gaps are and the needs, and ensuring that the learning is always relevant for the people that we are supporting. So now thinking about our Train the Trainer programme as well, this has been key. This is our scaling engine by establishing a cohort of trauma-informed champions, whether that's across all different sectors, statutory, voluntary organisations. We feel this really does embed that ownership and expertise within the different organisations themselves, hopefully making the learning resilient and more sustainable. And just to give you an example here of our work with Warwickshire Community Safety Partnership, we know that a child doesn't live their life in silo, and they encounter massive ecosystems really of different services every single day. Therefore, true systemic change means that we really must consider moving from beyond those traditional medicalised approaches. And this is exactly what drove our partnership with the Warwickshire Community Safety Partnership. We set out with a clear shared objective right from the beginning to explore how system-wide trauma training could directly support multi-agency frontline teams in adopting those essential trauma-informed approaches. So crucially, this wasn't just about abstract training, it was explicitly designed to support the rollout of their regional serious youth violence strategy. So to make this sustainable, we utilise a two-tiered approach. So thinking about the learning from the previous slide there, first we focused on leadership. So we had our senior leads from the partnership attend our Trauma-Informed Train the Trainer programme. And this really did help ensure that those strategic decision makers had the tools to embed this philosophy directly into their organisations. So second, we went wide. We delivered targeted trauma-informed training to an incredible 150 delegates across the entire community safety landscape. And this included frontline personnel from police, local authorities, fire and rescue, the probation service, different health agencies, and obviously our voluntary sector partners as well. So by bringing these distinct sectors into the same room, we established a unified shared language, as we've been talking about today already, and for addressing, hopefully assisting us to address vulnerability and understand the behaviour that is behind the trauma responses that we do see. So the impact of this approach is best captured by feedback, and hopefully I've got that on the next slide. Oh, no, I've lost it. It's gone. Oh, I haven't got this a slide for this, but we did capture, obviously with everything we want to evaluate and capture the impact and the outcomes of the training that we do. And we had some fantastic feedback from delegates, particularly from the Safeguarding Partnership, to talk to us about how it's really helped them kind of support the key themes throughout their serious youth violence strategy, and that they are rolling this training out internally as well with a view to broaden that offer even further. So we will support them with that. And yeah, that feedback is the ultimate proof, hopefully, of the model's ripple effect by training the trainers and equipping frontline public-facing staff, that we're not just delivering a training course, we are actively helping our community safety partners adapt their daily approach, shift their culture as well where needed, and to become truly trauma-informed from the ground up. And now I'm going to hand over to our lovely Emma to talk about connecting children.
Thanks, Becky. Yeah, so I just want to share some of our learning about why we really believe that social approaches are so crucial for our children and young people, particularly those who have complex needs and may present with a range of needs and being vulnerable to violence, exploitation, and potential struggles with their mental health as well. And a lot of our work sits alongside that specialist intervention. And of course, as you know, Andrew said at the very start, it's not about not recognising the need for those particular types of interventions, but actually we want to make sure we are offering our children, young people, what they need when they need. And so one of the questions that we're always asking ourselves is, what else could we possibly offer our young people? Next slide, please, Beck. So the way that we frame this is through what we call the rule of 167. So even when our children and young people can access an hour of special support each week, and we know that even sometimes this is what they could struggle with, actually for all of them there are still 167 other hours in the week where life is still happening for them. Their relationships are being built or broken, identity is being learnt about depending on where it's being based. And we can see our children, young people engaging with activities and groups that sometimes might increase or decrease their confidence, might increase or decrease their risk. And actually, this is where the opportunities are for us to really interact with them and really potentially change the trajectory of their lives. So we need to be very mindful that actually if we only put all of our attention and resources solely on that 1 hour of specialist support or whatever they might be able to access, we really risk overlooking, understanding and engaging with that wider context where that young person is actually living their lives and experiencing it. For a lot of our young people who've experienced trauma, they have classically been met with a very medical-based approach in the past of what's wrong with you, what needs to get fixed. What we want to do is shift that question from what's wrong with you to actually what's potentially happened to you, what's been missing, what's been lost, what have you potentially been subjected to that actually has left you with a need that hasn't yet been met by anything. So the questions that we're asking is, what relationships are missing, what opportunities are missing? And so that social approach helps us bring that curiosity, stopping us from trying to just fix that child, believing that we're the experts in the room, but actually giving that space, time and attention to the child to be able to tell us actually what's missing, what's wrong, and what they need next. Next slide, please, Beck. So just from what we did at the very beginning of our project was we went to our young people and asked them, what do you want? What do you need? If we are setting up a service for young people who've experienced things like this in their past, what do you need? Or what would you want us to do to be included or to have to be included in the service? And what they told us is that they didn't want to have support that was reliant on labels. Please don't label me mad or bad, and connect me to communities, connect me to people who are kind, who actually care about me. And this is something that we has really driven all of our work and what we really have underpinning everything that we do, everything that we try and focus on. And this is why we truly believe that social prescribing is one of the most powerful approaches that we can use with our children, young people, especially those who've been subjected to something like trauma. Social prescribing is quite well recognised in the adult world, but actually we've really recognised through the work that our Positive Directions practitioners have done with their young people is that social prescribing for children and young people is so different. It cannot be lifted and shifted from the adult world to the children's world. And so we've been really learning through our practitioners of what it looks like for genuine, safe and effective social prescribing for children and young people. And we've created this lovely model here just to try and put a visual on actually what we believe and what we do. And something that we want to be really mindful of is it's not actually just the activities. We're not talking about signposting. We're not talking about sitting with our child in a room and pointing a direction of maybe you should go try that basketball, let me know how it goes. For genuinely effective social prescribing for our children and young people, it has to be underpinned by a relationship. There has to be an adult in their lives that cares about them, that is asking, what are you interested in? That has the time and capacity and curiosity to sit with that young person and help them explore what they might like to do, why that might be that a powerful intervention or activity for them to do. It's also incredibly crucial that we have more of that facilitation for our children and young people, not just because of the barriers they naturally face, whether that's finances, travel, any of the other natural barriers that our children might face, but also we want to be really crucial that we are not putting the expectation that they can safeguard themselves accessing this wider community, that actually we still are doing our due diligence, making sure that we are supporting our young people to access safe spaces with positive relationships. It's incredibly crucial that part of this facilitation is also that reflection, that our young people need to be able to try a range of things. It's not just a tick box exercise of, you're into football, we've decided football, that's it, that's what you have to do now. But actually, part of this journey is a young person learning about themselves. Part of that reflection is they go to that activity or community group, they get to come back to a safe space and actually reflect on, what did that feel like? Did it meet the need the way that I thought it would? Is there anything else that actually is missing for me? And actually all of that is positive. If a young person tries a new activity, comes back and says, I didn't like that, that's great. I'm so glad we know that about us now. I'm so glad we know you wanted to try basketball and we learned basketball wasn't for you. Fab. Let's see what we can try next. It's important that they get to positively try things and it not be a failure if they want to try something else. That is just another part of their learning journey. And it's so important they get encouragement. A lot of our children, young people this is what's been missing for a lot of their lives. Someone with that genuine positive regard for their interests, for their journey, and making sure that we are always using that strength-based approach for them. Next slide, please, Beck. So what this looks like on the ground in Coventry and Warwickshire, we split our social prescribing approach into two different categories. We use a universal approach and an enhanced approach. Our universal approach is about helping our young people access that almost free or very low cost activities within the community. So what we are very lucky actually across our areas that actually we do have a wide range of safe and amazing activities and groups and settings for our young people to access. It's just sometimes knowing what is there, what's available and what's okay to send our young people to. So what we did was create our Positive Pathways platform, named by our children, bit of a mouthful. And what we did was pull together a directory of directories so that we can professionals, parents, even if appropriate, young people themselves can access that open access platform and find what's close to them and what they're interested in. And like I said, low cost or free across the community to try and reduce any natural barriers that might be experienced or faced by our children or their families. What we're also doing through training that Beck's just been talking about is trying to encourage the use of social prescribing as an actual approach that anyone engaging or supporting children, young people engage for them to use as an approach, that actually, even though social prescribing started in those primary care practices, even though we do have particular workers, light-link workers who've been set up and have the capacity to do social prescribing for their roles, actually social prescribing can be done by anyone. And again, especially for children and young people, it's quite crucial that they don't get referred to another service to be offered social prescribing. For them, the most powerful thing is the worker, the adult, the individual who they already have a relationship with, who they already know cares about them, to use social prescribing as an approach. So actually that already created relationship is part of that facilitation to help that young person access whatever they want to in the community. We also have an enhanced offer, which is specifically for our children and young people being supported by our positive directions practitioners. Again, just to test what it looks like when we take away all the natural barriers that our young people face when trying to access more of those specific offers that they're interested in. So as Lynn mentioned, we did a needs analysis at the very start of our project, and we found some gaps in those group offers for children and young people across our areas, things like equine therapy, sport and talk sessions. So we commissioned group activities that our young people could access and enjoy and really thrive from. And we also ring-fenced particular funds for our young people to apply to with their practitioners and request to use some of that to access particular activities themselves in the community. And this could look like asking for football boots, so actually they could go to a community group, doing hobby groups, learning a skill. We've had such amazing wide range of activities that our young people are interested in, which again just really highlights the individuality of their needs, individuality of what works for them, and really again always teaching us what does it mean to give genuine choice to our children and young people. Next slide, please, Beck. So one of the ways that we measure impact is through SWEMWebs, which stands for the Short Warwick Edinburgh Mental Wellbeing Scale. And this is a really simple, very child-friendly scale that just asks some very simple questions. It's the short one, there's a longer version that's 14 questions, this is only 7. Just asking very simple questions of how a young person feels about themselves and about their future. And we measure that pre and post both the group activities and the individualized activities. And just as we can see really clearly on the slide here, just a real improvement for our children and young people after they get to access the things that they've chosen, the things that excite them, and the things that sometimes could be overlooked as an intervention for things like mental health, but actually we're seeing sometimes is the most powerful intervention that there could be. Next slide, please, Beck. But more for us, we don't want to just rely on numbers and data, we also want to focus on the stories. And so I just want to really quickly share, I'm going to call him Adam, but one of our young people who was being supported by one of our positive directions practitioners. So in his background, very sadly, he was subjected to abuse when he was very young. He had been living with his mother and stepfather up until until he became known to us, because actually he was taken to his biological father's house, dropped off by mother who was doing a hands up, I don't really want to engage with my son anymore, and went away, and he was dropped off with basically someone who was a stranger to him. He didn't really have a relationship with his father. He definitely wasn't a place that he felt safe, and it was at this point that he was referred into our services. So we had a young person not having a space where he felt safe, presenting with quite high risk behaviours, including carrying knives in the community, and really struggling to access any settings like educational or support services like mental health. And what our practitioner did was amazing. I was lucky enough to go shadow some of her work, again, just to learn from it, so we could always continue to share what approaches are working with our children and young people. And what she did was just start with relationship, getting to know him, being curious, not making any assumptions about what he wanted to do, but just being really child-led in a lot of the interactions and approaches that she did with him. Learning about his interests, about animals, bikes, music, and she structured her support around that. Some of the work that she did very early on was just going through for walks in the community, where they would just try to find stray cats that he could say hello to, or riding his bike around the community, and then beginning to ride to places like the shops and riding back. And what this was doing was building consistency, was building trust, and building relationship. And this young person from all the other services, looking at him, looking at the complexity of his needs, and the concern about his potential high risk behaviours, what would classically be assumed or offered to him actually was completely different to what he wanted. He just loved going to parks and playing. Actually, this was something that was missing from his background, from his childhood. He just wanted to play. He just wanted to feel young again, and he wanted to feel safe. And what our practitioner was able to do was then start to bring father into that and use what she then knew about this young person to then build relationship between him and his father. They accessed the individualized funds and actually went go-karting together to again really build that relationship and build his confidence in accessing those types of spaces. And then from that, he was able to access our commission group activities, accessing things like our sport and talk sessions, which classically he would have presented as struggling in those types of settings, just with the meeting new people and not feeling safe. But actually he was able to attend the full sessions on offer and just really thrived and enjoyed that. And then the amazing outcomes that we saw was him coming off being about to come into care. Actually, he was feeling safer at home. He was able to access an educational setting again, and then he and his father were able to then access those mental health services that were crucial. And then actually, well, that was the right time for him to access that. Next slide, please, Beck. Well, there was meant to be, there we go. So just before we play this video, just a final learning that we had was we wanted to share about our commissioning journey very, very quickly. That we were approached by Warwickshire Police for their custody teams, and they wanted support in creating some artwork for their green rooms, which are spaces in their custody centres for young people to be able to, for them to engage with their young people that weren't the traditional cell settings. And so we connected with a local youth group that we'd previously worked with, asking them to help with this. And what we learned and what we loved was that actually we thought we were doing a very formulaic commissioning. We've been asked for this artwork. Please, can you help us with this and help the young people get involved? And actually what they did was bring us back to the reason actually we wanted this artwork. The artwork was to help the relationships between police and the young people in the community, in those green room settings, but actually it was those relationships and understanding and awareness of each other that was the crucial part of it. And this youth group just took this idea and ran with it, that actually it's not just the artwork, but it's actually the relationships they already had with the young people, and also recognizing the range of creativity that the young people had. And so what they came back with was, of course, the artwork, but actually at that they also had a podcast they did with the young people and a music video that's been written, performed, and you'll see created a whole like based in the custody suite settings, working with the police teams there, just highlighting actually we're not just, when we're commissioning, it's not what we're trying to commission that's important, but it's who that actually already has the relationships with the young people. That's the crucial part. That's the bit that actually makes change for the relationships we're trying to build. So if you want to play a bit of the video back, hopefully the sound will work.
Hopefully the sound will work. Yeah, if you need me to pause the video at any point, please just give me a nudge. But yeah, if somebody could say if the video works, please.
I'll give you a thumbs up.
Put my heart into the art, I'm just expressing myself. Put my time in other people and invest in myself. If it's the lyrics on the page or the brush on the paint, it's like the arts keeps me sane, cause I love to create. And if you're feeling under pressure, take a breath and relax. Focus on the here and now and don't reflect on the past, cause the past can't be changed, it's already gone away. So you gotta stay focused on the moments of today. Yeah, you're feeling like you're stuck and you're just looking for a way out. Gotta keep your mind strong, don't know how it will play out. I know you're feeling stressed and you really wanna break out, but soon you see the sun through all the rain cloud. Cause it's never too late in life to make a fresh start. The sooner you begin, the more you'll give yourself a head start. Life is like a movie, it can get all dark and gloomy. Keep on moving and you're soon to see the best part.
You gotta think before you speak, take a second to breathe. I know you're feeling in a panic, staying calm is the key. You gotta think about the future, all you want to achieve. There's so much time for you to chase all your dreams. See, I've been there before. have to question it, just feels like they won't stop digging. Yeah, I had to make a change, this is not living, but soon I'll be there at the top, and that's God willing. The mistakes that you made don't define who you are. You used to hide in the dark, and now you shine like a star. Took a negative and flip it to a lesson to learn, and that's a place that I won't ever return. I won't ever return.
Take a breath. It's okay to be scared. I've been here before. Man, I'm just locked in a someone. I just really want my freedom. Done a lot of bad things, but you know I never mean it. I see families around me, and you know they're still breathing. Holding in my breath, so I could just slow down my breathing. Take a step back and just look at the bigger picture. You don't want to lose your brother or even your little sister. Got to reflect on my issues, but you know I'm still risking it. Life is a lesson, but painful like a blister. Can't get out of this life, negativity's around me. Got back on my feet, but you know I'm staying grounded. I found my new life, and my new life has found me. I got a story to tell, but you know my story drowned me. Not every day my mind is safe now. Peace when I lay down, praying every night, cause God got me to pray now. Mature physically, but mentally I'm on a playground. Success is my option, and that's what I crave now, crave now.
Thanks, Beck. And that's the end. So yeah, I think just a closing reflection, just when we're thinking about our young people and violence reduction, instead of just thinking about the moments where things could go wrong, which obviously we do have to have a lens on, think about what we're not just trying to take away, but actually what we're trying to add in for our children, young people, recognizing these as the protective factors. Back over to you, Nicki.
Brilliant. Thank you so much. That film was brilliant, and just knowing those young people have curated it sort of means something else, doesn't it? So I want to thank you all so much. So to our presenters, Andrew, Lynn, Emma and Becky, it's been such a rich and thought-provoking set of insights and contributions. So genuinely, I'm really, really thankful to you. And it's a really helpful opportunity to explore what integrated, relational and community-based support can look like in practice for children and young people. And it was just, you know, fantastic to hear the examples of child-led approaches and child-led choice, which sort of really resounded loud for me today. And just to have context really around the virtual learning cafes here at the Youth Endowment Fund. So our purpose is really to create space for shared learning across sectors, and here we're really focusing on health and the intersect between the justice system, but also, as Positive Directions have talked about, and Andrew, across the wider system, as these young people are not in isolation. So I think it's really important that we can hold that system view in mind. And it's really about opening these useful conversations about how different parts of the system can better understand and support children and young people affected by or at risk of violence. So genuine thanks to Andrew and Positive Directions for stepping forward and doing that today. So we've now got time for questions, reflections and discussions. So please do pop any questions in the chat or raise your hand if you'd like to come in directly. Be really great to hear if there were certain things that resonated with you, what feels relevant to your local contexts, and maybe whether this has prompted you to think differently about your own practice. And while people are thinking, about that. So to give them a moment, I thought I might start off with one. So it's a question for all of you, and it's just really asking what has helped partners understand that relationships, community connections, and shared formulation are not separate from the interventions, but often are the intervention, is what I was hearing, especially when systems are so under pressure at the moment and looking for traditional responses.
I'm happy to pick that one up, Nicki. I guess having a test and learn approach is a really safe space to be able to test out different models of care. And it's true to say, when I take myself back to 2021, 22, when we were talking about this, I think there was some reticence within our system. You know, we've got a very traditional model of care, which is a very medicalized model. Definitely children were being seen as mad or bad, and that's absolutely what the children picked up as well. So I think it's a really safe space to trial out new ways of working in a more managed and controlled way. Again, you can make very small changes to practice. I think, and we had the ingredients. I guess my background was a head of safeguarding, and obviously, you know, an early adopter of the framework for integrated care in the community. I wanted to test out other ways in which we can interrupt some of these children's journeys, because I knew, you know, through the role that I did, what the impact was to those children and families. And, you know, we put the ingredients together, and those ingredients came not just from our children and families, but from experienced practitioners as well. And we did a needs analysis of our system, which helped us to understand what was working well, what were the strengths within that space, but also what were the areas of opportunity and development. And that's where our framework came from. Again, Andrew mentioned earlier that it's not one size fits all, but what the framework did, it gave us those prompts where we needed to explore, particularly around a case formulation approach, more integrated services. And again, it was really fascinating even speaking to our speech and language therapists, OTs, who have been very traditionally based within a medical setting, within a clinic-based setting, and to move some of those practitioners into children's services. Again, we had some experience of doing that across our systems from a speech and language therapy point of view within youth justice, but our occupational therapists, we didn't have a space, we didn't have any experience in our particular system, so they developed a community of practice from an OT perspective, both within Coventry and Warwickshire, but also externally as well, to understand what might work. And that was really interesting, having the opportunity to be exploratory, to be innovative. I think Andrew mentioned about courageous leadership. I think you need that when you're potentially nudging a super tanker of attitudes and beliefs in a different space. But yeah, I probably could talk about this all day, but it's a tricky thing to do, and it's a, you know, you can have many ideas, but start off small and beautiful would be my advice. Just test it even in your space within your teams. Obviously, we have the opportunity to look at it from a whole system perspective, so get buy-in from directors for children's services, directors of public health, integrated care boards. Obviously, at that point, we were based within an integrated care board, and being head of safeguarding within the ICB allowed me to have those more strategic conversations. But we also needed to land this within a practical setting as well to test it out.
Brilliant. That's really helpful, because what you've described is you did take the time at the start to do the diagnostics, didn't you, to really understand the area, what was working well and where the gaps were, and I thought it was really powerful, the stats around the speech and language therapy in respect of the reoffending was 0. So I think that data speaks volumes, doesn't it? Thank you. Andrew, if I invite you in.
Yeah, I think it's wrong if we say that partnership work, this is this makes the partnership working, because I think the partnership working has always been there. It always has done. And that's the one thing we absolutely knew, was that there was really good pockets of really good practice everywhere for these vulnerable young people. And often, you know, they've been developed out of crisis, and so systems come together. But what this has done is, well, obviously it's brought some funding in, which always helps. But it also gave that permission to do things slightly differently as well. And I think the interesting thing from a health colleagues is understanding where health sits in this scenario as well, because we do have our statutory responsibilities, we do have our services that sit neatly here. But actually, how does health inform and support a young person that's bouncing between education, social care, kinship care, foster care, you know, all of those sorts of things? What's the role in health? And that coordinating, supporting and understanding is where that comes in. So I think the partnership working is, people have, you know, jumped at this when it's been come on the table sort of thing, but it's then having those conversations, how it brings together. I think where it's difficult and where we're having conversations now is how that sits at government level, because we all work in different areas of the government. So we're under Department of Health, or we're under MOJ, or we're under DFE, and there's their own priorities, there's their own ministers, they're their own Secretary of State. How do we get that integrated, shared understanding and combined understanding at that level, so as it falls down to those on the ground? Because those on the ground are really, really trying to do this, but almost without that permission to do something differently, because the funding sits here or the funding sits there, or our responsibility sits here or responsibility. If we allow that to change, that's where that really works. So the work that Positive Directions and all our other Vanguards have done have allowed me to almost change my narrative and start my narrative at that government level to say, we really, really need to look at young people in this way. Yes, it might be health funding, and the cost savings may come at a local authority, education, social care level, but that's fine, because that's what we need to do right now for those young people.
And there's something about, which was touched on in the presentation, was the longitudinal impact, isn't it, from the early intervention, actually the sort of cost savings from when you take an approach at an early intervention, actually sort of what you prevent then through adolescence through to adulthood. I guess that's harder to capture, but also there's probably some formulas that could predict that as well. Andrew, I had a question for you, if that's okay. So you talked about the framework for integrated care as being a catalyst for cultural and organisational change. I wondered, from your experience, and it may be for the Positive Directions team as well, what does it look like when a local system is really starting to embed this, rather than treating it as another project? So when they're like meaningfully.
Yeah, I mean, I suppose it's when you see all the staff work in the system using the same language and understanding. So, you know, we've seen referrals come in to various different services that might say, you know, 13-year-old Tom is badly behaved, just disrupting everything in the class, needs mental health support because there's a mental health need. That's the most traumatic referral you could ever see, because actually, but when those systems start working together and that referral changes to something like 13-year-old Tom, we're noticing a difference when we talk about certain things. We think he's being triggered here, and we wonder if it's something to do with this. If we intervene, if we produce an intervention like this, would that work? You know, those are the sorts of conversations. It's the change in narrative across them. But again, as I said before, if we can truly see the funding change as well, and where our resourcing is changing, then we know we've absolutely got it as well. But we see now when we go to our services like Positive Directions, and when we go to all our other Vanguards and we go and see them, when I'm stood talking to a clinician, a director of children's services, a social worker, and a teacher, I know I've got it, because all of those people in that one room working through a system together for these young people, you know, are there for working in that way. It can be as simple as that, seeing that change as well.
Brilliant, thank you. Emma.
I just wanted to probably add to what Andrew's saying and give an example of where we know that actually it's been well transferred. So our Positive Directions practitioners are based within the Educator team that's based in a local authority. And sometimes we've had spaces on our commission group activities. Obviously, we open it wider and say, please, you know, anyone from being supported by the Educator team, they are also so welcome to access this. And what we then became aware of, which was so fantastic, was that the Educator team actually are now putting their funding and resources and their work into doing their own commissioned social prescribing groups. So they've set up a local youth group that they all run themselves, and a boxing group. And this is just the most, for us, like the most perfect outcome of social prescribing happening completely external to us, that actually they saw the benefits of it so much, and they were like, well, why aren't we doing this ourselves? Actually, this is simple, this is doable, and we've seen the amazing outcomes for our young people. So they are now doing it themselves, and it's just been so wonderful to see young people access those groups and that learning just shared wider.
That's brilliant. That's sort of learning in practice, isn't it? Right there. Dawn, you've got your hand up. Can I invite you in with your question, and hopefully behind the scenes they can take your mic off and camera off.
Hi, yeah, good to see everyone. Thank you. My name's Dawn Foster, and I'm a public health specialist. I actually joined today with a different hat on, because we've been doing some work up in the Humber region through the Violence Prevention Partnership around developing youth health champions with a violence prevention specialism. So that's kind of what hat I was coming on with today. But in other parts of the work that I do, I've just been putting some links in, because I'm pretty involved in social prescribing for children and young people. So I co-authored the national toolkit. And we've been working with NASP, the National Academy of Social Prescribing, and we've developed the flip book. So we called it Connecting the System. So it links to the discussion that you were just having. So I've just popped that link in there as well. So I was really surprised. I was like, oh, they're talking about social prescribing. So I put my other hat on for a second. So NASP also have a national vision around children and young people social prescribing, and I really want to commend the work and the discussion, because it's so exciting to hear that everything that we've been researching and putting in evidence towards over the last, gosh, it's getting on for 8 or 9 years now. Like, this is what I've dreamed of, is like hearing people pick it up and take the concept. And Emma, what you were saying about it doesn't have to be a link worker in primary care doing this work. It's about trusted adults, safe spaces, having the skills to work in that social prescribing approach, and doing exactly what you said, walking with that young person through that first kind of what matters to you conversation, where the young person is probably going to go, I don't know, no one's ever asked me, and supporting them through that process. So yeah, absolutely brilliant hearing all of that today. And just to echo and support what Andrew was saying as well around we've seen some really good models of joint funding, where education and health and youth justice have come together and joint funded. But I really do see that one of the challenges being around, everyone's got very distinct outcomes. So we need to record this and we need to report on that. And actually, just again, you know, Andrew, thank you for putting forward taking it right up to that government level to say we need to work in and around the child and the network around that child, and try not to silo the monitoring and the outcomes. But yeah, just so I'll pop in the work that we've done around youth health champion training, which again it evolved through the NHS, but we've kind of developed it into a violence prevention national pilot with the Royal Society of Public Health and the Humber Violence Prevention Partnership. So I'll pop that evaluation in as well, and hopefully it's of interest.
Thank you so much, and thank you for sharing, because it sounds as though it really resonated and aligned with the work you've been doing, which sounds like 8 years. It's been a very long time, so thank you so much. So before we close today, we would really love your feedback, and my colleague Janina's put a link in the chat, and you'll be invited, so I'm sort of offering it now for you to complete, because we really want to learn and hear your thoughts and reflections, both on today but also on future virtual learning cafes. I also want to signpost you to a few ways to stay connected with the Youth Endowment Fund. So the ways to do that is to sign up to our newsletter, explore our website, where you'll find a wide range of resources such as our toolkit, which is our best bets on what works for children and young people through evidence and research. We also have reports that we've published, some test and learn reports, very much a theme from today, and sector guidance and practical resources, as well as details of previous and upcoming virtual learning cafes. I'd also really encourage you to listen to our brilliant podcast, Safe. It's available wherever you get your podcast, but you can also access the link via our website. And finally, our next health-focused virtual learning cafe will be in the autumn, and we'll be focusing on A&E navigators, which is part of our recommendations in the youth sector guidance, but we'll also have voices of researchers and clinicians in that space. So please do keep an eye out for that. And then finally, a huge thank you again to all the contributors today. It's been such a thoughtful and insightful session. So it's been a really hot day. So I'm really mindful for being so, amazing in your presentations. And hopefully you've got time now to get hydrated. And then also final, a big thank you to Lucy and Janina for making the session run smoothly behind the scenes. And then finally, thank you to all of you for joining, for remaining part of this conversation, and on particularly, as I've mentioned, this hot day. So please go. You've got a few minutes, hopefully, before your next meeting, and hydrate yourselves. And thanks so much for joining. Thank you all.
Thanks, Nicki.